What would you do if you were a paramedic called out to an acute myocardial infarction? What would you do if you knew the patient's prognosis was not good? What would you do if the patient refused medical treatment and transport? Let's get the facts from the case. Mr. Benson is experiencing all the symptoms of an acute coronary syndrome. He has allowed QIS to treat him for angina, however, pain has not been relieved. He has an advanced care directive that states he does not wish to have life-sustaining measures, including CPR, and he has a daughter that wants him to go to hospital but is more than 2 hours away from him. A patient's unequivocal right to refuse medical treatment is well established and is ethically justified by the principle of autonomy, according to which people have a right to self-governance to act freely in accordance with a self-chosen plan. Control over our body has been taken to be central to the interpretation of autonomy. In the context of end-of-life care, the right to refuse treatment places a recognised limit on interventions by medical officers who must respect refusals even against their best clinical judgment and even if a patient's life is at risk as a result. It would be unethical for paramedics to pressure Mr. Benson into consenting for care regardless of whether they think it is for the better choice. The next principle is non-maleficence, which is do no harm. The paramedics have a difficult decision as they can harm the patient through both action and inaction. By not transporting Mr. Benson, there is obviously a high risk of deterioration into cardiac arrest, and alternatively, going against a patient's wishes completely disregards their right to refuse. There needs to be time to explain to the patient so that the paramedics aren't being negligent or careless. The paramedics have applied the principle of beneficence to their decision-making by informing Mr. Benson of his condition and the risks he faces if he does not seek further treatment. Furthermore, they can support his decision if they are confident that Mr. Benson will seek treatment from his medical practitioner. The principle of justice requires the paramedics to respect the wishes of the individual whilst maintaining a high standard of practice and what is appropriate for the patient.
Everyone has the right to refuse medical treatment and transport. The patient should be informed of the clinical assessment findings, possible conditions, recommended treatment, and possible risks associated with the condition if treatment is not provided. VRCA is used to assess the validity of the decision of a patient who refuses medical treatment and transport. The elements of a valid decision to refuse treatment and/or transport include voluntary, informed, relevant, capacity, and advice. Keeping this in mind, paramedics must abide by their code of conduct by respecting the patient, being transparent about the risk involved in refusing treatment, and acknowledging their responsibility for actions taken. As a paramedic, we have a duty of care. Our duty is to exercise reasonable care and skill in the performance of our duties. This exists as soon as the call is made. Negligence occurs when there is failure to provide an adequate duty of care. Although Mr. Benson refused treatment, he accepted the administration of GTN. Is it negligence that the paramedics administered GTN when his blood pressure was 90/60? Yes, this could have caused further harm to the patient. A side effect of GTN is hypotension and can only be administered if the blood pressure is above 100 systolic. This is also a breach of standard care, as paramedics know and understand the risks, especially when Mr. Benson is refusing transport to hospital. This could leave him at greater risk of having an MI.
Although it has been deliberated upon to remain respectful of Mr. Benson's wishes to refuse treatment, an alternative course of action should be discussed. This action in this scenario would be to disregard Mr. Benson's wishes and transport him to hospital for ongoing treatment. It would defy the ethical perspective of this case, but supports the clinical aspect of the case greatly. Physiologically, this alternative could place a mental and emotional strain on Mr. Benson, as the passing of his wife is a large reason his choice is as it is. The legal and administrative section of this alternative states that we legally have no right to take Mr. Benson against his will until he loses capacity to make his own decisions, meaning that taking him to the hospital would be legally wrong. Clinically, however, the fact is that the QAS treatment plan for presentation of an acute coronary syndrome, transportation to hospital is paramount to the health of the patient. There is no doubt that Mr. Benson's current health status, the hospital is where he is meant to be. The only constraint of pursuing this course of action is the fact that it would be disregarding his requests, which in this case he has the full capacity to make. It is ethically and legally wrong to pursue this course of action, however, the clinical benefits could possibly outweigh the risks. In Australia, there is no direct authority on the right to refuse treatment, but given the weight of common law authority in other jurisdictions, it seems reasonable to conclude that a right to refuse treatment would allow a patient to make decisions that would result in their death. The courts have recognised that adults have the right to say in advance what they want to refuse treatment if they lose capacity in the future, even if this results in their death. Refusal of medical treatment, particularly when it is not consistent with good medical practice, is one of the most difficult decision-making areas in healthcare, not only because the law is so complex, but because of the multiple variables that have led to treatment refusal. Despite this opinion, if a patient has an advanced health directive, treatment refusals can be potentially overturned on good medical practice grounds, whereas under the common law, the principle of patient autonomy remains paramount. In this case, Mr. Benson has located his copy of his advanced health directive and does not want treatment. It is a legal document that states his wishes and directions for the healthcare. Mr. Benson's advanced health directive states he does not want any life-sustaining measures implemented, irrespective of the circumstances or the condition from which he suffered, that may have necessitated such measures being implemented. The Advanced Health Directive comes into effect if the paramedics believe Mr. Benson is unable to make his own decisions. In the pre-hospital setting, paramedics must assess the patient's capacity to make the decisions and gain consent. A person should be considered competent to make a healthcare decision if they appear to be able to comprehend, retain and weigh up relevant information and then make a choice. Mr. Benson is deemed to be competent in making decisions by the paramedics, which makes his decision not to go to hospital valid. Under the Power of Attorney Act 98, Mr. Benson has the right of all adults to the same basic human rights and to exercise them as he sees fit. He has the right to participate to the greatest extent practicable in decisions affecting his adult life. Mr. Benson's power of attorney is his daughter Jenny, and in this case, Mr. Benson is still able to make decisions, making Jenny's decision to send him to hospital invalid. If Mr. Benson was to deteriorate rapidly, Jenny would be able to decide to send him to hospital. However, she would need to keep in mind her responsibilities as a power of attorney. These include ensuring decisions contribute to health and well-being, choosing the least intrusive method of treatment where possible, consider his wishes and views, consider advice from healthcare providers, act honestly and with reasonable diligence to protect the principal's interests. For Mr. Benson, he has clearly expressed his wishes for his healthcare treatment, both orally to the paramedics and Jenny, and written in his directive. Overall, after the ethical, legal, physiological, and clinical aspects of the case have been viewed and evaluated, the decision to remain respectful to Mr. Benson's decision to stay in the comfort of his own home and to only receive further treatment at his wish. The finalisation of this case obeys majority of perspectives present in this case, which consequently further supports his decision.